Thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today I'm here with Dr. Michael Doctor. Is that right? Dr. Michael Doctor. I love that. The co-founder and CEO at Dock Health. How are you today?
Great. Thanks for having me, Jared.
Absolutely. Probably the coolest name for a doctor ever. Am I right?
It certainly opens up some doors and starts some conversations. So it's been fun.
It's kind of a tongue
I didn't have much choice
too.
in life with a name like
Yeah,
that.
exactly. Yeah, Dr. Michael Doctor from Dock Health. You can't say it fast. You can't. Even though Dock Health is easy to say. Really cool. Well, thank you so much for being a guest. I'd love if you could kick things off by telling the audience a little bit about your background, and then we will go from there.
Yeah, so I'm a pediatric gastroenterologist at Boston Children's Hospital. I was the clinical director of innovation there, saw lots of exciting startups come in and out of the hospital, helped a bunch of technology spin out of the hospital, and had my own clinical pain point of managing all the to-dos of clinical care, and was frankly struggling with my own sort of cognitive burden and burnout, frankly, with all the sort of stuff that we had to manage as a clinician. And that was, really the inception of what is now Dock Health, which is a HIPAA compliant task management, workflow management tool to really help teams collaborate and ultimately work better together, manage tasks for patients. And I was just amazed that we had all these wonderful technologies like Asana and Trello and all these tools that I was using in my life as a, innovator in healthcare, and just, saddened that didn't exist for patient care. And so we spent the last couple of years building that out. We spun out our company about a year ago from Boston Children's and raised a seed round from August Capital. And now we're out in the market, just trying to figure it out.
Love it. Yeah, no, that's super exciting. I'm a big fan of all the different project management tools that exist, right? And then after I talked with you, I did start thinking, I'm like, there's like nothing for help, because you can't use it, right? If it's not HIPAA compliant, you can't use it. Can you talk us through that piece a little bit? Because I think a lot of people understand it, but there's still, I was reading, I don't know if you put it out or someone else put it out the other day, that there's a lot of salespeople too that keep calling it HIPAA. They'll reach out and say, are you HIPAA compliant? And then they say, that's the best way for me not to buy your product. But clearly there's some gaps in exactly what that means. Can you talk about the importance of having a HIPAA compliant task management platform?
Yeah, HIPAA, HIPAA, not HIPPA. So that's the other giveaway. HIPAA compliance basically means that you're good stewards of the data, that there is obviously encryption at rest, or in storage, in transit, and then importantly, audit trails. So you know who accesses the data and when. But the whole intent there is to really be protecting patient identifiable information, and whether it's a patient's lab result or the fact that they have a mental health disorder or any other element of their healthcare, it's important to make sure that only certain people have access to that data. And if they do access it, we need an audit trail around that. So we can go back and patients can say, hey, who has looked at my chart? That sort of accountability is necessary in healthcare. The HIPAA compliance technology component stuff is getting easier and easier. So there are tools that, in fact, some of our competitors, the sort of big players in the task management, project management world, have HIPAA compliance, offer it at a significant cost because it's not their core business. But it's not just HIPAA. I think just to qualify that for us, it's not just about sticking a HIPAA label on it and saying it's built for healthcare. We are purpose built for healthcare. So things like having patient contacts, integrating with electronic health records, understanding workflows of the clinicians and their teams, and sort of all the nuances of healthcare. Again, there are consumer tools out there that you can pay for to be HIPAA compliant. That does not mean it's built for healthcare. That is certainly our unique value prop.
Interesting. Yeah, it's much needed. And I'm thinking back now, before I was aware of Dock Health, like the conversations I've had with practice managers and everything. And there's a large opportunity for what you've built and what you're continuing to build. Can you talk us through that, I guess, that ideal customer? That way, if anyone's listening, it's on their radar and they can reach out.
Yeah, absolutely. Thank you. I mean, the first kind of amazing thing is that this concept of task management or project management is completely novel to healthcare. So, many other industries have been transformed by tools like Trello, Asana, Basecamp, Jira, project management, task management. In essence, it gives a team the ability to collaborate, to have accountability around to-dos. So, I give the example of there's a clinical intent. I'm a physician. I want to place an order for a prescription. I take care of children with Crohn's and colitis, for example. I want to prescribe them a complex biologic therapy that requires an infusion. All I have to do is place the order in the electronic health record, and my part is done. What people don't realize is there's 37 downstream administrative tasks that have to actually happen in this delicate dance to actually get that patient from my clinic to an infusion 2 weeks later, with insurance authorizations and phone calls and forms to fill out, and just wrangling between infusion centers and insurance providers and pharmacies and all this. So there's just a tremendous amount of work, what we call the other half of healthcare, that people, it's just operating on phone calls, post-it notes, Excel files, and these sort of antiquated and frankly analog tools that don't capture the data around that, don't have any insight into accountability around who's doing what, have no ability to be highly reliable. And so what we're doing is creating that structure, that accountability, that process, to be reliable, to be more efficient, to be collaborative. And so, any practice really, and this is what we're just discovering as we're out there in market, we're helping dental practices, mental health practices, internal medicine, GI, nephrology, really, there's no domain of medicine that doesn't need this. They just need to have an awareness that there is value in this and that the electronic health records aren't doing this for them. So it's those sort of forward-thinking, more tech-enabled practices that are getting it and looking for it. And so obviously we're happy to help.
When you and I were getting set up for the interview, we did talk about a part, I believe you mentioned it was like educating the market on it's like workflow management, like this type of workflow management. What are, I guess, some of the, if you can speak to it, don't feel like you need to, but the challenges of that like these task managers, what are some of the things that they're asking you, I guess, that you're able to help with? What's the, why Doc Health is what I'm getting to.
Yeah. Again, I mean, I think what we have learned in talking to hundreds of people now, or thousands, is there are just simple practices that an organization needs to do reliably and with accountability and some visibility into where things are in flight. So a perfect example, every practice we talk to hopefully is bringing in new patients. So the onboarding of a new patient is like the number one problem that people are trying to solve. It's a simple one. There are far more complex ones, but the simple need is we need to bring patients into our practice in a reliable fashion. The doctors want to know where things are in flight. Everyone wants to have the patient come in and know that we've received the medical records, that the insurance thing has been approved, their HIPAA form is signed. So there's a series of tasks, just something as simple as bringing in a patient into the practice. A series of tasks that are, get the HIPAA form signed, call the patient to confirm appointment, make sure that we collect the medical records, take care of any referral. And then there's the fallout after the visit. And all of that is being done just by happenstance. There's no system or process around that. And so people, the front desk is calling the patient twice looking for the same thing. And the patient asks don't you guys talk to each other? And the reality is they don't, because there's no way to do it. So they have little post-it notes stuck to their desktop, or they have email. So what we're doing is creating that sort of process, structure, accountability around something as simple as onboarding a new patient. And then when the doc says, hey, who's coming in next week and where are they at in that process, they can look at the progress and see okay, there are these 3 new patients coming in. Each of them has had their medical records received, and we're on step 7 of 10, whatever it may be.
What's next? What are you really excited about, looking forward to? We're halfway through 2021 now. What are some of the things that you're excited about in terms of Doc Health?
Well, a couple of things. I think, first of all, we have built, we spent the last year really the the sort of challenging times of the pandemic for everyone, really we made the best of it and actually really doubling down on our product. And we now have an amazing, workflow management, task management tool that's built for healthcare, and the foundation has been laid. And we can put it up against publicly traded task management solutions, which is pretty cool. Where we're going increasingly is, well, how do we really integrate into the life and the work of healthcare? So we're now on the Athena marketplace. We're embedded with Cerner at Boston Children's Hospital. We're working on some Epic implementation. So increasingly embedding into the electronic health record, and then over time automating and integrating with more systems that are of value to the practice or the organization. So what we want to do, as selfishly as a physician, I want to make the lives of physicians and providers, clinicians, administrators alike, I want to make their lives easier. I want to make the work of patient care more reliable. And so the more that we can learn from the work that they're doing, automate those things, and ultimately predict what's going on, that's where we're headed, and that's what I'm excited about. And a lot of that's going to be possible as early as this year.
Well, I'm super excited to continue to follow your progress and Doc Health's just continued growth.
Thank you.
And again, thank you so much for coming on the podcast. Hopefully we can have you come back again to tell us where you're at and what's happening, what's new.
I love it.
But yeah, thanks so much.
Thank you.